No doubt you'll agree this is good news for Australia. Tell us a bit about the vaccine. What does the real-world data tell us about the efficacy of the Moderna jab?
Thanks, Ash. Yeah, look, it is great news. This is very much like Moderna in profile. It has a similar safety and efficacy in trials and effectiveness in the population. So we're looking again at over 90% efficacy, and it has some important differences. While they're very similar vaccines in the way they're produced, and it's why the Australian government didn't look so closely at it initially, because we already had our arrangement with Pfizer. But now with the supply challenges, having more vaccines in the basket is a good thing. But equally, what we've agreed to is not just the 10 million doses this year that might take some of the pressure off that Pfizer supply, but it's also the 15 million next year are the ones that will be tweaked to these new variants. So this will be the updated vaccine and a start to that next phase of the vaccine rollout, which will be looking at both whether we need boosters, which they believe you do potentially for Pfizer, just with waning protection, but also this adapting the vaccine so that it's a better cover for those variants we've seen emerge. Not so much the UK, that seems to be okay, but the South African and Brazilian strains, and possibly the one from India now.
Yeah, well, we heard the Health Minister saying this morning that Moderna is the most advanced of the vaccine products when it comes to that capacity to adapt to booster requirements. When we see those variants emerging around the world, can we expect all the vaccines are going to be continually updated? How often do you think we are going to need to get boosters? Is it still too early to tell?
We don't know yet about that waning protection. So people, we're still within that year of the first doses being given at the trial phase. So we haven't yet got those first people to follow up for any extended period of time to understand what happens to their immunity. So there's some signs that it might wane, so you might need to boost. But equally, we have seen these variants emerge. That's more likely when we've got massive levels of transmission around the world, which we're seeing at the moment. You're still likely to see these variants potentially emerge. But it's a continuing thing we have to watch for even as we roll out the vaccine. So for those variants, if they start to dominate, if they're the ones that the vaccines don't cover as well, then absolutely, that idea that we have a booster that updates our own immunity to cover these latest variants is something we might be looking at. So it might not be an annual thing, but it might be just tracking what happens with the virus, how successful our vaccine programs are, and therefore, how we best build that strategy going ahead to keep this virus under control. The other thing about Moderna, it has some simple things that actually do differ. One is it's got an extra week between first and second jab. That probably doesn't make a big difference. But it does also have those freezer requirements, but just in a normal freezer, not the -70 of Pfizer. And it's also something that can be kept in a fridge after you've defrosted it to, start to administer doses. So there might be some practical benefits of Moderna over Pfizer as well that might help us in the latter part of the year when we're trying to vaccinate that younger adult population.
Professor, I'm keen for your take on the current outbreak landscape as it is at the moment. We've had another day today of no new cases in New South Wales or Victoria. Is it too optimistic to think that we've just got lucky in these instances when we know that the infected people in both of those cases were out and about in the community for several days? Is it likely that other cases just aren't being picked up yet?
Look, what we've seen in New South Wales is their case did pass the virus on to his wife. That was the variant that we're seeing cause such problems in India at the moment. So, we have to keep an eye out because there could be those odd cases that haven't been picked up with very mild or no symptoms that might mean the virus is out there. So it does pay to, keep following this for a few weeks to try and reassure ourselves that we're not just missing something, that we really do have this contained. Victoria's situation is a bit more optimistic in the sense that we don't have any confirmed community transmission yet. We have that exposure in hotel quarantine. We've now had that confirmed by genomics, and this person brought it back to Melbourne. Their household contacts haven't tested positive. So that person probably wasn't that infectious. And while we do have known exposure sites, and hopefully, again, everyone at those tier 1 sites now coming forward for testing, if we're not finding those people positive, doesn't mean they might not yet develop an infection, but it does mean they might not have led to secondary cases through their own movements over this last week. So I think we can be optimistic, but every time this happens, you just have to keep that watchful eye out and hope that, you know, everyone's on the lookout for their own health and symptoms so that we don't miss cases and we know exactly what's going on.
Yeah, the key to getting back to normal does seem to be vaccination and the vaccination program. That's what we keep hearing from the government. There is this debate in some quarters about whether or not vaccinations should be made mandatory. We've seen calls this week for return travellers to be vaccinated against coronavirus as a sort of condition of entry, really, into the hotel quarantine system. From a public health policy perspective, what do you think about mandating vaccinations for some groups of people? Is that a smart policy direction, or would you be wary of going down that path?
Look, I think, you know, there isn't an appetite to make them mandatory across the board, but there are going to be situations where, just as a safety measure, people can't be allowed to do certain things unless they are vaccinated, not only for their own protection, but for the protection of others. And we see that in certain workplaces now. And so that is an important thing. We're not just talking about that for this vaccine. We've been doing this for some time now with flu in aged care or hospital settings and so on. So there is a precedent for having requirements around vaccination to enable people to protect them so that they can do certain jobs in a way that's safe for them and for their workplace. So that's a bit different to what we're talking about with return travellers. I suspect that more and more of our return travellers will be vaccinated to avoid being positive so that they don't get their trip cancelled on them. And but some people will be from countries where they can't afford to have that. Now, a lot of those people will be glad to be home. If they're offered the vaccine, will probably take it. As for now, even in whether you're vaccinated or not, you have to go through a certain testing regime in hotel quarantine. If you don't agree to the testing, so it's not been mandated, if you don't agree to it, you end up staying in hotel quarantine for longer. And so there are these consequences that are actually, it's a bit whether you're using carrot or stick, but basically saying if you do vaccinate, you can leave at the end of your period if you're showing no symptoms and you're not testing positive. If you don't test at the end of your period, and possibly if you don't get vaccinated, maybe the quarantine period's lengthened if we're worried about these new variants. So there might be things that work as incentives rather than necessarily mandating it. As soon as you mandate something, people, you know, get worried about it. If you give them choice, hopefully they'll make the right choice, and the easier choice will actually be vaccination, but at least you're still giving people that option.
And the concept of having to spend more time in hotel quarantine sounds a pretty good deterrent to me. Professor Catherine Bennett, appreciate you joining us with your expertise. Thank you.
Thanks, Ash.